Now I get an opportunity to come to travel various places to learn, meet new people and all, to keep updated. Actually, when you to keep updated, we attend various CMEs, there's some CPDs, various conferences, all which are held in different places and all. So it is a very ample opportunity to go and meet new people, and per se, travel is also there. So like that is one opportunity. The diabetes is actually a branch of medicines which focus on the study, diagnosis, treatment, and management of the diabetes. So to break it down in simpler terms, we can say that diabetes is a conditions where the body does not either produce enough insulin hormone that regulates the blood sugars or does not use it effectively. This leads to the problem which is commonly seen. This is the high level of sugar. So at per se, when we say about diabetology comes under actually the Department of Endocrinology and Metabolic Disease, it basically a subspecialty branch. But when we say about the diabetology, it is a subspecialty of the general medicine itself. But again, general medicine, one specialty is there is the endocrinology, which basically deals with the hormones. Since we are dealing with mainly the hormones and all, so basically the difference between the general medicine is that general medicine treats all the times. It deals with the infectious disease, but our main focus is basically on the sugars only, sugars and its complications. If somebody wants to have pursue a career of medicine or diabetes, first he need to from the HS he have to be in the science stream. Then the next he has to prepare for the entrance examinations. In India we conduct the NEET exam. Then after qualifying the NEET as per his ranks and all, he will get his seat in some medical school. Then he has to go on passing doing the MBBS course and all, which will run for around 4.5 years. Then after that he has to do some rigorous training, which is the internship. Then again he has to prepare for the next main step, which is now it's NEET. But after coming few years it will be next. So it is basically a screening test which will decide his which subject he wants to pursue. Then the next will be they have to do, if somebody wants to do diabetes, then he has to do some undergo other training like fellowship in diabetes. Like it's a long pathway, but basically when one step is initiation is very important. First of all, the HS in science stream, then clearing the NEET exam. Then after that he or she have to do the undergraduate for 4.5 years. Then after next step will be the next exam, which is which for to select is the PG. Then after that for a career in diabetes, he has to do some training either in form of MCH or DM or any fellowship or diploma. That's all. So internship is must. Like to get a license after passing our MBBS final exam, we get a temporary license. To get a permanent license to practice in our India, we need to do internship which will be of the 12th month. So in 12th month we'll be posted in different department: medicine, surgery, gynae, then pedia, then community medicines, then orthopedics. We'll have to learn all the training, all the rigorous training and all. It's basically necessary, and also it's very like it is actually the main if you say the roots of a medical career. Because now if somebody wants to say where did you learn the most, actually I could say that internship was the most important and the most colorful period of my entire medical life, where I got the exposure of all the different departments and all. If somebody wants to be a doctor who want to be diabetologist, we have lots of paramedics are working in the Department of Diabetologists, so they can pursue that career also. We need the diabetic educators, we need the nutritional also, we need the diabetic food care specialist also. So for the training program, lots of universities are providing some blended program also. But thing is that because we know only the blended program is not enough and all, but we need to have hands-on training. That is the best. Yes, if somebody wants to have, there are lots and lots of options are there. Okay, basically in India, the best place to learn the diabetology is basically our government, that AIMS and PGI. We have our CMC Vellore who gives a very good exposure of the diabetes training. Then we have our Mohan Diabetic Institute in the Chennai, which have lots of training programs. Then RSSDI, which is the main academic body of diabetology of which study in India, they also provide some different courses and all. So apart from in abroad, we have the Joslin Diabetic Institutes, we have the John Hopkins Universities, like then Royal Liverpool Academy, where I did my fellowship and all like that. So its options are there and all. Basically, if we are for India, we should first try for the government, then we can go from the private and all, like Apollo Hospital, RSSDI. So basically, a resident doctor is one who stays in a hospital for 24 hours. Basically, not hospital premises, and attends to patient as and when India. In India, a senior resident doctor is a medical profession who has completed their post-graduation education, MD, MS, or DNB, and joined in either medical college or tertiary care hospital to engage in further training and gaining both practical and teaching experience in a specialized field of medicine. Being a senior resident doctor is a crucial step in the career of a medical professional in India, providing them with the opportunity to gain extensive hands-on experience, refine their clinical skill, and contribute to the educations of the next generation of doctors. It also the pathway to join as a faculty in medical college or to be a consultant. But most important thing is that that senior residents are doctors who have completed their masters. You need to be very good clinician. That is the most. You need to be very logical. You need to be very calculate, because we are dealing with the like insulin and sugar. One wrong step, it will take my patient's life only. Suppose like when we say that that's when sugars mean what, high blood sugars. If there is very high blood sugar, we provide insulin. If sometimes we give some, if our doses is correct, if I don't like ऐसे हम लोग ने dose दे दिया, if I don't calculate, ultimately it will lead to hypo, and it's a serious complication also. So like one more thing is a communication. I already saw. The next will be the expert clinical skill. Like one more important, patience. We need to be very patient. ऐसा होता है like the people will come and say that ye theek nahi hoga, but we need to be very patient. And also one important skill, time management, because like I have to see around 70-80 patients daily, and also being I need to be very fit. Like the patience and time management, it's must. Then I think it's all the things are same for all the department also. Like not in any career, time management is a challenge itself only. So basically, diabetologists are doctors who specializes in managing and treating diabetes. They are the expert in understanding the complexities of the disease and the best way to control the blood sugar to prevent the complications. Their basically main role is the diagnosis. So diabetologists will prescribe some tests if somebody have some high blood sugars. Then also diabetologists that plans the treatment, like with the medications, then some lifestyle modification program, the diet and all. And also one important thing is that diabetes is at first a chronic condition and also. So we need to plan for the future also. Suppose a patient comes with the age of suppose 35, 40. So like it's just diabetes, like India itself is a diabetic capital only. Now we found lots of cases of diabetes. But when a patient, so we have to manage for, if like average our age of India as a being an Indian citizen, our average life expectancy is about 80 years. So 35, we have to plan for up till the 80 years. How to like in simple terms, we say that is the healthy aging and all. So basically we are the doctors for the life and all. A day in a life of a diabetologist involves a mix of patient care, education, some administration work, continuous learning, and also I get some time for myself also. My morning starts off with workout to keep me physically fit. Then I go to hospital to see indoor patients. Then I start my outpatients clinic. Then again at the afternoon, I attend some seminars also. The day is structured around consultations, patient education, staying updated with little medical research and advancement in the diabetes cares. So basically, balancing with the profession responsibility with person is crucial for maintaining healthy well-being for me to be diabetes. So it's like a struggle and all. It starts with 8 a.m. and the ends is basically at 11 p.m. because since is the diabetologist is which is a career which is started after your post graduation basically, or after you have done the undergraduate. If somebody from different, if they don't like, then they can switch, because when you have but the thing is that they have some pursue some training again in diabetes and all. If somebody from basically from surgical background, if want to career, then they have to again have to train back, move back to where they are when they started from there after the internship and all. So that's is the problem. But yeah, everyone can switch their career, but thing is that their insight should be there, that I want to serve, I love this part and all. But otherwise it is no point of coming to, because in diabetes there are lots of struggle also, because lots of struggle, lots of challenges are also there and all. The patient adherence and all. Basically, patients are our God and all. They are our bread and butter. So sometimes we find that patients are like nowadays the cost of treatment is very getting high. Like in the minimum cost we need to treat and all. This is the challenges and all. Like ऐसा होता है ना, बहुत सारा patients comes and they don't have money also, and they will find that real sugars is all. And also to keep them, suppose a patient's coming with very high sugar, we need to start initially with insulin only. But at the time when ऐसा होता है ना, सुई लगने से they will fear and all. But that adherence, and if like doctor to आने से तो they will give injection only. That is one challenge. Then the next challenge is basically the like being updated and all. You need to be updated. The technologies are coming up. We have like everyday treatment protocol changes and all. Diabetes at first say we have to deal. It is say we have to be collaborate with different department. Say we have to collaborate. We collaborate with the surgery. A surgeon may also call me if somebody has to selected from some. If somebody wants some surgery with sugars, they will call me. Then that intersectoral or intrasectoral coordination is one challenge actually. To keep in touch, to build rapport with all the department and all. Otherwise, there's no point of. I think the three changes is the patient itself. The next will be to keep updated, with the time and all, and also the next challenge is the coordination with the different other departments. A career in diabetology progressive from the foundation education and training to junior residency, then the senior residency, advancing to the leadership position, the clinical practices, or research or any academics. Each level involves increasing responsibilities, specialization opportunities, and potential contribution to the field of diabetes care and management. The main progression is that we need to be stay updated, learn, and every stages has opportunities and all. So we can expect a starting of salary of around 12 or 14 lakh per annum, and the end is the limit. And so freshers may expect around starting will be 12 lakhs per annum, and the end is, so when you are senior, that is it's very high and all. Like it depends on you only what you want.